Hi everyone, happy Friday. I wanted to do a quick video today on footwear. So as many of you know, I am a master instructor for the Evidence-Based Fitness Academy. I teach under Dr. Emily Splickle, who is absolutely amazing, and this program is all over the world. So one of the things that is really important is, and that people, my patients and clients ask me all the time, are what shoes should I wear? And there's, of course, it depends answer, because really it depends on somebody's foot type, it depends on their past injury history, it depends on their activities, it depends on their overall physical ability. So there's a lot of factors that go into it. But before we get into footwear, let's kind of just talk about why that's so important. So we always think of the foot a lot of times as just a biomechanical structure, and really it is a very, very powerful neuromuscular structure. So when we think more specifically about the neurological component to it, is we want to think of the skin on the bottom of the feet. So we have all of these different small nerves that are responding to different stimuli, things like texture and skin stretch and deep pressure. And so when we get this stimuli, when we sense it via the skin, it is passed through our nervous system. So it passes through our brainstem, our limbic system, our emotional center in our brain, goes to the neocortex. So it's ultimately going to drive some kind of output or response. So when we have good sensory stimulation or optimal sensory stimulation, then that is going to drive good movement. So think about balance and gait and just overall quality of movement. And when we constantly block that sensory information, then that can negatively affect how we respond. Because what happens is we become more in a reactive state as opposed to an anticipatory state. So we ideally should be reflexively stabilizing before our foot even hits the ground, so that we can generate force and we can generate resistance and power. But if we are constantly in a reactive state where our nervous system is just always reacting to any type of external stimuli, then unfortunately that is when injuries happen. That is when we developed poor movement patterns, and that can eventually lead to an injury cycle. So going back to the shoes, the reason why this is so important is that if we are blocking this information with socks and shoes all of the time, so if we think about, you wake up in the morning and you put your shoes on, and you wear them all day, and then you wear them home and you wear them to the gym, wherever else you might go, a lot of times people have something on their feet literally all day long. And so you're constantly blocking this really, really important information that's coming into your body. So not only is it really important to be barefoot and actually stimulate the small nerves in your feet, but it is equally important to choose the right footwear to enhance your natural foot function and not replace it. So I'm going to go through some different specifications of the shoe that we would look at, and just some reasons why you may choose something or you may not choose something in the shoe. The first thing is we'll look at the heel to toe drop. So if you look from here down to here, this is a 0 drop shoe. However, most shoes you're gonna see are a 10 to 14 millimeter drop from here to here. So you can kind of think of that as almost like wearing a high heel. So it kind of pitches you forward. So what happens is it kind of locks your foot in a rigid position. So a reason why that could be valuable if somebody had an Achilles issue, current or potentially an older issue, and you were just for a short term, just kind of shortening that Achilles tendon. But ideally we want to be at least at a 4 to 8 millimeter drop. Not everyone can tolerate a 0 drop. So somebody that has a more rigid foot type might not be able to tolerate that, and that's okay. So the next thing we'll look at is the forefoot here. So you can see here, this looks like the shape of a foot, right? But a lot of times when we look at the forefoot, it looks like a point here. And the most important thing here is just to think about it from, okay, does it look like a foot or does it look like a high heel that's just kind of cramming your feet in, excuse me. When you are pushing off in your gait cycle, your toes need to splay. So for females, it's about 3 millimeters. For males, it's about 5. And that's in order to create this rigid lever to be able to push off of. So if you don't have enough room to splay, you can't create the appropriate stiffness and rigidity when you're pushing off in your gait cycle. The next thing we look at is torsion in the shoe. So can you twist it like a rag, right? So our foot is meant to spiral just like the rest of our body does. So if you are blocking that, then that spiraling has to go somewhere. So a lot of times that could ultimately be maybe in another joint. So it's important to be able to have some motion here. The midsole is another thing where when you are bending, you want to think about, can you bend your toes just like you would in your normal gait? If this is really rigid and you're not able to do that, again,